Lumbar disc herniations are very common, and I think almost all of us at some point in our lifetimes will suffer from a lumbar disc herniation. In this video, we will discuss what they are and what the treatment options are for lumbar disc herniations. I would think of a lumbar disc herniation as part of the degenerative process of a disc. What can happen is the outer covering of the disc can degenerate a little bit and or be injured. The outer covering is called the annulus. The inner part of the disc, called the nucleus, is then able to protrude or herniate out of that injured annulus. And a disc herniation can come in all shapes and sizes. It could be a bulge, a tiny fragment, or a big herniation. And the disc herniations can affect the nerves in the low back to varying degrees. This patient had a disc herniation here at the bottom disc, L5S1, and you can see the material here on the left side, and it's affecting the nerve. So disc herniations can cause sciatica. The annular tear or the annular injury or the disc injury in general can also cause lower back pain. So what can be done about a disc herniation? Well, we know that a lot of disc herniations will improve without surgery. And so there's some optimism here, even though an acute disc herniation can be very painful. The chiropractors will look at usually the underlying biomechanics as to why the herniation occurred in the first place and start a process of trying to correct those. The physical therapists are focused on movement patterns that help with the symptoms and really are engaging you in continuing to stay active, because we don't want patients with an acute lower back problem like a disc herniation to go down a road that leads to disability and chronic problems and pain. Medications and injections can also be done. These initial herniations cause a lot of inflammation, and if it's a steroid given orally or injected near the disc herniation, that can help with the inflammation. Also, Tylenol and nonsteroidal anti-inflammatory medications can be helpful. And then there's some nerve pain medications that could also be used. I would emphasize that we don't want patients to be taking very much narcotic with a problem like this. If the symptoms are not improving with time, then sometimes patients will go to surgery, and the goal of the surgery is to remove the herniated fragment, not the whole disc. We go in and through a small incision, remove a little bit of bone, a little bit of the ligament that's under the bone, and then just fish the herniation out from underneath the nerve so that it's not compressing the nerve anymore. And that surgery we will talk about in other videos, or you could go on our app and watch examples of disc herniation surgery. I think the message for patients that are suffering from a lower back injury of some kind, and especially a disc herniation, should know that there's lots of people that can help you. We want to think holistically about these problems so that we can help you recover and be on a good road towards recovery for both short-term and long-term positive outcomes.